Restoring the Foundation: Why Cellular Health is the Key to Reversing America's Chronic Disease Epidemic. Introduction. The United States spends over $4.5 trillion annually on health care, more than any other nation, yet despite these staggering investments, the rates of chronic disease continue to rise. Conditions such as heart disease, cancer, diabetes, and obesity remain the leading causes of preventable death and disability. These are not just statistics. They represent the growing suffering of individuals, families, and communities across the country. With nearly half of U.S. adults facing high blood pressure and diseases like cancer and diabetes increasing year after year, it's clear that the traditional healthcare system, focused largely on symptom management, is falling short. In this article, we explore the root causes of this crisis and why a shift toward optimizing cellular health may offer a more sustainable and empowering path forward. The chronic disease burden, a system under strain. Chronic conditions are responsible for over 90% of the nation's $4.5 trillion in annual healthcare spending, while breakthroughs in surgery, pharmaceuticals, and diagnostics have extended life expectancy for some. They have not stopped the rise in non-communicable diseases, NCDs, conditions largely driven by environment, lifestyle, and metabolic dysfunction. Here are some sobering facts. Heart disease kills one person every 34 seconds in the U.S., totaling over 700,000 deaths annually. Cancer continues to rise, with over 2 million new cases reported in 2024 alone. Nearly 47% of adults have high blood pressure, a silent condition that damages organs over time. Diabetes affects 38.4 million Americans, and obesity now impacts 41.9% of all adults, both tightly linked to insulin resistance and systemic inflammation. Despite advances in treatment, the focus has remained reactive, managing symptoms after disease is established rather than supporting the body's innate ability to restore and maintain wellness. The role of metabolism and cellular dysfunction. At the core of nearly all chronic diseases lies a common thread: impaired cellular function. Our health is built from the inside out, beginning with how well each cell in our body produces energy, communicates, repairs itself, and responds to its environment. When metabolism breaks down, it affects glucose regulation and insulin sensitivity, blood vessel health and oxygen delivery, detoxification and immune surveillance, inflammation and oxidative stress management. These cellular processes are foundational. Without them, the body becomes susceptible to long-term imbalances that show up as fatigue, pain, mental fog, hormonal disruption, and eventually chronic disease. Cancer, diabetes, and heart disease, a shared root cause. Although heart disease, cancer, and diabetes present differently, they share underlying contributors including chronic inflammation, mitochondrial dysfunction, poor energy production, elevated insulin and blood sugar, excess body fat, particularly visceral fat, poor detoxification and oxidative stress. Emerging research now links many cancers, not just metabolic diseases like diabetes, to disrupted glucose metabolism. Cancer cells thrive in inflamed, sugar-rich environments and often suppress the immune system's ability to detect and destroy them. Likewise, the conditions that contribute to atherosclerosis, the foundation of most heart disease, such as high triglycerides, low HDL, and small dense LDL particles, are closely tied to poor metabolic flexibility. Why the current model isn't working? The modern healthcare system, while life-saving in acute emergencies, is not designed to prevent disease. It was built to manage infections, injuries, and acute conditions, but chronic illness operates on a different timeline and requires a different approach. Instead of asking, what pill can we give? And we must begin asking, what does this body need to restore function? This includes addressing nutrition, stress, sleep, movement, relationships, purpose, and environmental exposures. It also means supporting the health of the cell, where all healing begins. Optimizing cellular health, a new path forward. Cellular health focuses on nourishing and protecting the body at its most fundamental level. It involves supporting the energy-producing mitochondria, reducing chronic inflammation, improving detox pathways, and restoring metabolic flexibility. Steps to support cellular function include a nutrient-dense diet rich in whole foods, antioxidants, fiber, healthy fats, and quality protein, limiting added sugars, seed oils, and ultra-processed foods that disrupt insulin and mitochondrial function. Adequate hydration and electrolyte balance to support cell communication. Consistent movement, even walking or stretching, to increase oxygen delivery and mitochondrial efficiency. Restorative sleep and circadian alignment to support hormone regulation and repair. Stress management practices such as breathwork, time in nature, and emotional processing. Targeted supplementation when necessary to address nutrient deficiencies or mitochondrial support. This approach doesn't aim to cure overnight. Instead, it helps the body do what it is naturally designed to do: repair, adapt, and thrive when given the right conditions. Conclusion: we are not failing because the human body is flawed. We are failing because the system we rely on doesn't support the conditions that create true health. With chronic diseases becoming the norm rather than the exception, the solution lies not in more prescriptions, but in a profound shift in focus from managing disease to restoring function. By bringing attention back to the health of our cells, we begin to reconnect with the body's intelligence and healing potential. The path toward health doesn't have to be extreme. It begins with small, consistent changes that support the foundation of life itself, the cell.